Assalamu alaikum, everyone. As promised, we've already added a lot of people. We don't have room for much people, I think. Um, Assalamu alaikum. Hello, and welcome to everyone here. Today's session is going to be uploaded to YouTube as well. So those people who are going to miss it, they're going to get the link in an hour or 2-3 hours whenever I'm done with uploading it on YouTube, so they can watch it there. The session is basically about orientation of all the doctors for the Plab 2 exam. What are the do's and don'ts, and what are absolute necessities that you cannot miss, specifically when it comes to this exam, in order to pass safely and in order to ensure that you get done with it in one go and you don't have any doubts about it to repeat it or anything. And what are the things that the GMC is constantly changing that you need to pay attention to. So I'll first introduce the speakers of today. We'll begin with Dr. Imran. Dr. Rana Imran Asif took his Plab 2 exam in 2019, and he's a consultant ophthalmologist. He's been working in Pakistan for quite a long time. Then after that, he moved to, he's there in the UK, and he's working as a specialty registrar in ophthalmology in Dudley Hospital, Birmingham. Dr. Imran has mentored over 2 years a lot of doctors, and Dr. Zibran, Dr. Saher, we owe him a lot because he has mentored us as well in different ways to take the exam, in helping us control our stresses, in making sure that we take the exam as seriously as it is and not too seriously, and keep our stresses under control. So Dr. Imran has been a major help to not only us, to a lot of doctors, and I'm pretty sure a lot of you know him here as well. Moving on to Dr. Saher, she needs no introduction. She's famous for her notes, for the way she teaches, and for her method of teaching, which excels in everything, mashallah. She's been an extraordinary teacher. Even before she took the exam, she's been teaching quite a lot of students. And after that, she has continued teaching. She has taught from medicine to counseling to ethics, everything Dr. Saher has covered. About her, she's working in Saudi Arabia, and she's working in Medina in emergency medicine. And now very soon, Dr. Saher is going to move to the NHS as well, inshallah. She's going to bag a job. And then we have Dr. Zibran. Dr. Zibran himself also needs no introduction. He's an excellent mentor, and he has mentored more than 900 doctors so far by taking their mocks and teaching them the do's and don'ts of exams. Dr. Zibran himself has done MRCP, mashallah. He has done Step 1 USMLE, and he has done FCPS, Fellowship Exam of Bangladesh as well. And Dr. Zibran is famous for his Simon courses and other short courses as well. I'm pretty sure all of you know him. Dr. Zibran has been a very good brother to me as well, and we both have mutually prepared for our exam as well, while he was taking his and while I was taking mine. Coming to me, I'm a graduate of 2019. I'm from Pakistan, and I took my exam in January. And after that, I've been helping around students, especially through the groups, the secure bubble groups, where we discuss a lot of things, and they're quite active, not because of me, but because of the people that take the exam there, and their help and everything around there. And I myself try to facilitate people by making sure they understand the importance of what needs to be done, and they let go of all unnecessary stuff. So that's about me. Now I'm going to move to UK in 2 weeks, inshallah, and I'll start pursuing my career as a junior doctor in the NHS. So that's about the introduction. Now I'd ask Dr. Imran, I'd request Dr. Imran to come forward and share his advices about do's and don'ts of the exam, and what to do and what not to do. Assalamu alaikum, sir.
Walaikum assalam. Thank you very much, Ayesha, for your wonderful and excellent introduction. And assalamu alaikum, good morning, good evening. Where are you, doctors? I hope you are from the different part of the world. So good afternoon or good evening whatsoever, and good night. And as Ayesha mentioned that basically I am ophthalmologist, and most of the time I spend my life in ophthalmology. I started my ophthalmology in 1997. And then for certain reason, I moved to the UK. And then because I did my FCPS and did my FRCS 1 and 2, and then due to certain reason, I couldn't appear in the Plab in the for CS3. So I switched over to the Plab, and then I did my Plab. And the most important thing in the Plab that I failed in my first attempt, and that was in uh, July 21st, 11th of July 2019, and I scored 114 marks, and the passing score was 115.1, and I failed by 1.1 mark, and then I reappeared in the exam in 3rd of uh, October, after 48 days after my say first exam, and then I passed 15 stations, and I got 144 marks. So this is I just want to tell you one thing, that what is the difference between two preparations. And the most important thing is, I just want to tell you that it is a very doable exam. If I can do, you can do. Remember one thing. This is a very easy to pass, but it is very easy to fail as well. In when I use easy to pass, I use very twice, and when I use fail, I twice very 4 times. So remember one thing, it is a very easy exam to pass, but very easy to fail the exam. I will explain you why I'm saying like this. For this exam, it's been more than 2 years that now I'm teaching the Plab 2. Now, due to my commitment in hospital, I have started my job about more than a year ago, rather 1.5 years. And due to lack of time, sometimes it's very difficult for me to conduct these sessions. But still, those doctors who need help, I do some mocks with them, but sorry for that, due to very busy schedule, I'm unable to fulfill all these things. Now, I just want to tell you one thing, that most of the doctors that who did this Plab with me, I know about 20 to 25 doctors who have passed their exam. They didn't attend any academy at all. Ayesha is one of them. And trust me that without academies, you can pass your exam. Regarding this mannequins, please, I always ask my students to just watch the videos. These are more than sufficient for you to pass your exam. The most important thing in this exam, it is not the knowledge that you have, it is that how you convey your things to your stimulator or your patient, how you tackle them. And normally they judge you on 3 things. Number one is data gathering, IPS, and management. One more thing is, if your data gathering is very good, so your IPS will be good, and you can easily pass your exam. But if your data gathering is very bad, so you will not be able to pass your exam.
No sound.
Hello, doctor. We cannot hear you.
Yes, I
Hello,
cannot hear Dr. Imran. Now he's back. Okay, sir.
can you hear me?
Yes, now.
Yes, yes.
Please continue.
Yes.
Sir, we can hear you.
Can you
Please.
hear me?
Yes, we can hear you. Please continue. Sir, your voice is gone again. We cannot hear you anymore. We've lost you. Let's just wait for Dr. Imran to join us again because I think his link has dropped. I'll try to connect to him.
Hello, can you hear me?
Yes, yes.
Oh, okay. Sorry, doctors. There's some problem in my, I think, in my network connection. So I just want to uh, tell you about one thing that nowadays they just mark you on data gathering, IPS, and management. When your data gathering is good, your IPS will be good, and you easily pass this exam. In this exam, one thing is which is very important. You all must know that normally I haven't seen any doctor who failed the station by getting 8 marks. If you get 3 in the data gathering, and 3 in the IPS, so you can get 3 marks plus 3 6 marks, and in management you can get 2 marks. So you can easily pass these stations. To pass this exam, you must know your structure. You must follow your structure. And please, one more thing is, which I always ask my doctor, you should make one format. You should make one format and don't try to be remember that in which you need to uh, put something. For example, in every session I made my habit that I always ask diet, exercise, smoking, alcohol, and everything is like that. That if you just think that these questions are not important, and you think to skip these questions, then you can easily miss very important things. So it's better to make a proper this structure and then format and follow that in all these things. Number one. Number two, you must know that what scheme you need to use in different things. For instance, if it is a if you need to diagnose medicine case whatsoever, it's a gynae, it's a peds, it's medicine, ENT, whatsoever. In this, you need to know your structure. That will be the P1, then P2A, P2B, diet, excess smoking, alcohol, meftosa, and then examination and 7 steps of management. So this was my structure, and I followed this, and I got 51 in data gathering. Number two, for instance, the all other sessions, if it is a counseling session, my approach is past, present, and future. My approach is past, present, and future. What happened? Because in the counseling session, no need to do any differentials. No need to do any differentials. So that's why you can take these as the story past, present, and future. So in all counseling station, you can add if it's a missed MI case, if it's a missed case in which the doctor missed this fracture of the wrist or foreign body in the food pipe, blah, blah, whatsoever. So in all these stations, please, you need to make a one scheme like that, past, present, and future. Past means what happened, then the same history which we take in the medicine, and then present, the condition which is you are facing, that the complication of that in the future, that is the management. In all counseling station, my approach is arms, advice according to the risk factor. RAMS, you need to ask about the risk factor in the history, then advice according to the risk factors, then medicine, M for multidisciplinary team, and S for safety netting. So this is my approach for all these counseling session. It is very easy. If you know that, then it will be very easy for you to tackle all these sessions. Number three is most of the time, if the patients in the exam, if it is a combined session, then you need to know that how much history do you need to take, and in the examination, what you need to do. You can watch different videos. It will be very easy. If your exam is a month, you can say that in 4 weeks in time. So you need to watch videos every day, 5 videos every day. So in the meanwhile, you can go through all these videos thrice or 4 times. So it will be on your fingertips. You can easily do all these stations. Then in the counseling, in the ethical session, it is just talk, 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 and talk, and you need to listen to your simulator very carefully and respond accordingly. So it is there in this session, there is not one you can say that it's a true or any pattern is one person can give the different answer, the other person can give the different answer, but at the end of the day, you need to satisfy your simulator. And other thing is, there is certain things you need to take care of. For instance, if it is a case in which it is a safety, you cannot identify the patient, or you can the identity of the patient is very important, or this what we call this, where you cannot tell about the identity of the patient, or about the any disease of the patient whatsoever. So in this case, the main aim of this session is, at any point you cannot compromise on these things. So these ethical sessions, you must know about the law of that things, and you must tell your simulator in a very polite way that as a doctor, the confidentiality is the main thing. We are not here to tell anything about anyone. The other thing is, which the other stations, which most of the time they are in the exams, there are some psychiatry stations and some combined stations. So most of the time, these are 4 and 5 categories we can divide it. And if I ask you that how many stations are now in the GMC, most of the doctors will say that they are more than 450. But trust me, they are not 450. Actually, they are not more than 120, 125. These are just, you can say, that these are the slight change in the station, and we considered it a different station. For instance, if patient is refusing medication, if it is refusing warfarin, refusing steroids, refusing chemotherapy, so pattern will be the same. This is not a three. This is not a different stations. This is only one station. So my advice is, if you want to prepare for this exam, you must go through your notes. Please, you need to choose good notes. I read these Aspire notes and I stick on that. I joined the Swami Academy, but his notes were, you can say that they are very haphazard notes. You need to go through your notes and then don't read them again and again and again. Otherwise, you will be scripted. How you can say that you are not scripted when you listen to your simulator and then answer accordingly. Please don't assume anything in this exam, and please don't pull anything from your pocket. Whatsoever you need to go with your patient, trust me, you can easily pass this station. One more thing is, in this exam, it is not the knowledge they are they check, but the thing is, they just want to know that how good doctor you are, and in a worse situation, how you cope with that. And other thing is, your eye-to-eye contact, your body language, your hand gesture. These are all matters. When you enter in the exam, when you enter in the door, you can pass or fail the exam. For example, if you enter the door and slam the door, so this is not a good thing. So that's mean you are not a confident doctor. You need to enter in the cubicle politely, and you need to close the door without any sound, sit properly, and then talk to your patient. One more thing is, because alhamdulillah, more than 390 last time, the 390 doctors who has done this different cases or with mocks with me, most of them, they give me a feedback that we follow the structure and we easily pass the exam. So the most important thing in the exam, to pass this exam, number one, you need to sit in the exam. Most of my doctor, they ask me, Dr. Imran, should we cancel the exam? I always ask them, okay, if I ask you to prepare exam and your exam will be 31st of December 2030, 31st of December 2030. On 30th of December, you will say, Dr. Imran, can I postpone my exam in 10 years time? So it is, I just want to tell you one thing. Please use your time wisely and prepare yourself. You must know that how to pass this exam, and please make a groups and stick to your groups, and then you can practice with each other, and before exam you can do practice haphazardly with anybody else. So these are the few tips which I just want to tell you, and hope these it will be helpful for you all. If any question, I will be more than happy to answer after that.
Jazakallah khair, sir. It was very, very comprehensive and brilliant advices, and put very, very briefly and put very simply. If only all of us knew how to decently follow your advice and stick to your advice. Thank you so much, sir. It was.
Thank you very much. Thank you. Thanks a lot.
Now I'd like to call Dr. Saher to please unmute her mic and shower her knowledge on us, her advices on us, and so that we can learn from her more and more.
Hello, Assalamu alaikum.
Alaikum assalam.
How are you? How are you, everyone?
Alhamdulillah, everyone's good, alhamdulillah. Huge fan following. Ajay.
How are you, doctor? We are missing you, Dr. Saher.
No voice, Dr. Saher.
Dr. Saher, we cannot hear you. You need to go somewhere where you're audible.
Oh, well, I think there is nothing remaining for me, but still there are few points that I want to tell you people. First of all, actually many people, they are messaging me and they are asking me few things that are very important that I want to guide you. First is time period, that how much time period is required for Plab 2 exam. So it depends on your own preparation. If few people are a working doctor, then 3 to 4 months are enough, right? But for those doctors who are not working at all, or all those female doctors who are staying at home, so I recommend them to at least study 4 to 6 months. Am I audible to everyone?
Yes, Dr. Saher, very much.
Okay.
Yes.
Okay, because sometimes what happened, I already know a few of my friends that are not working, and they appeared in the exam in the period of 3 to 4 months, and it is not successful. So I just guided you. Those doctors who are not working, they are outside the field, at least give 4 to 6 months for their preparation. Time period is very important. Don't see that what other doctors are doing. Just think your own capacity and then book your exam. First thing. Second thing, structures. Yes, Dr. Imran already told you. And my notes are already there with the structures. So 90% stations are already there in my notes. But the important thing is just read the note. First, you should know how to use the structure, and just read the note once, twice, and then the new stations, because most of the people, they are so much afraid how to do new stations. So you can easily prepare your own notes from NHS website, and just you already know the structure. Structure is in front of you in my notes, and easily prepare any station by NHS. So this, because, and one thing more, I prepared the note 6 months back. So there are some updates in NHS. So please always don't blindly trust on my notes. Just double check, because sometimes there are new guidelines and they are changing it. So just correct it and also help others. Right. Third thing, many doctors, they are asking me about academies. Dr. Imran already told you that I myself know many doctors who passed the exam without any academy. But this is not for all. This is only for those doctors mostly who are working. If you are staying at home and you never work for the last 2, 3, 4 years, then please, better wasting money means, because we already spent so much money on different things like visa and tickets and all other things. So better join any academy, right? This will not only give you confidence, but also help you in your preparation. All right. Many students, they are calling me and asking me about the academy, which academy is the best. Actually, all the academies are best. And all academies like Aspire, Samson, Common Station, Friends, all are good. And all of them are good for beginners also. So if you are a beginner and you never work, or you think that you need more preparation, then please join academy. Right. Suppose you have less time and you you want to give your exam in 1-2 months, and you are thinking that you are already working in a hospital and your experience is good. So in that case, at least give some very good mocks. And according to me, for mocks, the best academy is Samson, but for the beginners, Samson Academy is not that much good. So for mocks, you can go for Samson, but for beginners, you can go for Aspire or Friends or Common Station, whatever. Okay. Another one thing that is very important, many doctors, they are taking mocks and basically why people are, because I know most of the people, they already know about Samson mocks. So believe me, this is my personal experience. I never talked about this to Dr. Ayesha, but this is the first time. If you want to meet mini Dr. Samson, so Dr. Ayesha is mini Dr. Samson, because she also know the latest station, and the way she is teaching you the mocks is same as by Dr. Samson. She also know the latest stations, the latest things. So this is very beneficial, because I know in her
Voice disappeared.
Dr. Saher, you're lost. Please return back to us.
sorry.
Oh, you're here.
Okay. All right. Now I'm audible. Hello.
Yes, yes, we can hear you.
Okay. In the exam, what you have to do, actually, after doing structures and doing all the stations, what happened? We are very good. We become very good in history taking, right? But we get less marks in the management. So for management, again, you have whatever the station you are studying from the notes, if you are reading myocardial infarction station, just read the management and make your own very short notes for myocardial infarction or whatever the station, migraine, whatever the station is there. Just make a very quick recap of the management. That is again very important, because we spend 4 to 5 minutes in history taking and just spend the 2 minutes in management. That is absolutely wrong management way. That's why most of the time I heard that doctors got 0 marks in management. So again, this is one thing very important. All right. Regarding on the day of the exam, one tip is, all of us, most of us, not all of us, most of us, like 80%, they are following the structures. They already, because in everyone is teaching all these structures and everything, and most of us, we already know it. So what we are doing the same stations, and it is same. So what happened for the examiner, it is difficult how to give more marks to one doctor and give less marks to another one. So the best way, when you are doing the station, at least try to use interpersonal skills sentences at least 5 to 6. And you should also aware of that I'm just putting my IPS more for getting more marks. Because what we are doing, we are spending more time on history taking, last 2 minutes in management, and no time for IPS. So IPS is very important, and you should I will give the example of Dr. Imran, because his interpersonal skills are superb, and there are few sentences he will also teach you in the group. Also, many times he is telling us these sentences. These are very important, like where to show your interpersonal skills. These points are very important. So whenever any patient is giving you a clue, like for profession or what you are doing at home, and like at any point, so you have to comment, and there are few things that are very important. So believe me, I think for Dr. Imran, his interpersonal skills are already very good. So he will guide you in a much better way, because he is in routine life also. This will helpful if you are using interpersonal skills in your routine life. Then we are easily capable of doing all this in the stations. Thirdly, regarding Simmen basically, it's a horrible
person with the blue eyes and blinking and in the start. And most of us, we are confused by this Simran. But I heard I heard Dr. Zibran. He is conducting session on Simen, and it's very good, very good. So those who are thinking that they have no time and they are unable to join an academy, any academy, believe me, the way he is teaching Simen, it is superb. And means for Simen, no need to go in the academy, and you will see that if there is any Simen in front of you and you are you are talking to that, it is same like you can practice it like having a pillow in front of you on the bed and just pretending that this is a patient and the patient is having shortness of breath. Then what happened, what you will do, or the patient is having allergy, something like that. So still what, and yes, and one thing in the last that is very, very important is please try to practice in a group with open video, because what happened in the exam, we are already nervous, we are already under pressure, we are already confused, we are thinking we don't know anything, and we are very shy because most of us, we are working in hospitals. Those who are working in hospitals, they are a little bit better in confidence level. Otherwise, those who are not working, especially the females, what happened to them in the exam, they are under more pressure. So please try to practice in the group with open video. So this will improve your confidence, because confidence is the key to pass. Don't show the examiner or don't show the simulator in this exam that you know the station, and don't show that you don't know the station, because both the things are very important. Just try to be very, very natural. Even if you know the station, just pretend that you don't know. And even if you don't know the station, don't show that you are under stress or you are in panic. Just try to be relaxed. And believe me, if you think yourself that you are in a clinic, you are sitting in a clinic and you are checking your patient, um, you are you are checking your patient in a routine way, that is this is what they need from you. So I think, is there anything else, Dr. Ayesha, you want from me?
No, Dr. Saher, mashallah, thank you. I'm not supposed to speak in Urdu. You said a lot of stuff that was very important, especially for working ladies, because you've been working and you've been managing like super mom, Wonder Woman. You've been managing a lot of things, and I think it would be very helpful to people who are parents, who are working, who are earning, and at the same time, because I myself, I would never understand the problems a person who's managing everything, a family life and a job, and then the exam as well. So I think you've very put everything together. Thank you.
Thank you so much. Thank you, Dr.
Dr. Aisha.
Ji, sir.
Okay, the thing is, which Dr. Sir mentioned, that the last one, most of our doctors, they just don't want to open their cameras. So I just now you can say I'm tired of this, but this is the most important thing. If you want to pass your exam, you should practice like that. Otherwise, when you will be in the exam, it will be a disaster. So it is the best practice. When you do your practice, please do the practice with the open camera.
Yes, because it's very important. You are able to pick non-verbal cues. What is the patient doing? Is he interested? Is he listening? Looking down, up? If you can't pick these, you miss a major chunk of the exam. Absolutely necessary.
Definitely, yeah.
Now I'll be requesting Dr. Zibran to please come forward and give his advices to everyone here. Dr. Zibran, welcome to the club. And I hope everyone benefits from whatever Dr. Saher and Dr. Imran said, and from Dr. Zibran as well. So Dr. Zibran, now you can start with whatever you have to say and add.
Yeah. Thank you very much for giving me the opportunity, Dr. Ayesha. And first of all, I must thank my mentor, Dr. Imran sir. He really helped me with my exam. And all the mentors who are talking today, like Dr. Imran sir is my teacher directly, and me and Dr. Ayesha, we are just very good friends. And in my hard times, Dr. Ayesha knows everything, how she supported me, and we have practiced together. And like the world is actually very small. I took mock of Dr. Saher also. Dr. Saher knows that, yeah, I mean, before her exam too. And, the world is not too big. And, this world, we are just, this world, we have to help each other. And I tell let's start with this one. The Dr. Imran sir said and Dr. Shahir said, like, practice in a video, okay? I mean, always do it over the videos. I mean, no need of feeling any kind of shy, because like 2 sessions are coming, which are on the videos. So open your cameras and whenever you are practicing, because this hand movement, this makes a difference with others. So always when you guys are practicing, so practice over the video with your practice partner, and keep your practice partner like 2 kinds of practice partner. One is fixed and the one is random. Okay, I mean, Dr. Aisha, can I share some slides? Yeah, I can share it. Okay. Yeah, okay. So just I'll be talking like 5 to 10 minutes, not I'm taking. Okay, so yeah, let's. I'll be starting with the stage of preparation. Good. So this exam is not a difficult exam. It's us who are making this exam difficult. Okay. So there are, I'll be going very fast. Okay. The stages of preparation, how you can do it, and the structures and I'll be going very fast. So there are some stages of preparation. You have to understand in which stage you are. Are you in the beginning or in the middle or at the final times? Okay. If you're at the starting of the if you are at the starting of your preparation, guys, can you muting all? Okay. So if you are at the, okay, you have to understand in which stage of preparation you are. If you are at the beginning of the preparation, then you have to focus more on the knowledge part and the structure. The key of this exam is the structure. If you have good structure in your head, then I mean you can go in any direction. Just keep the structure in your head. Whether first try to understand, is this medicine or is this counseling? Okay, a lot of doctors, they mix the things. In the counseling, they start doing the differentials. That is not the way of doing, doctor. I mean, in case of counseling, you don't have to do the differentials. Okay, I'll be coming to that. And in the middle part of the preparation, practice is the key. If you want to ace this exam, the most important part is the practice, and practice with some good study partner. I mean, the study partner who will tell you bad regarding your practice. I mean, we're not going to say, okay, you're doing great. Okay, this, no. Just choose some practice partner who is going to actually comment on your weak points. Okay, so choose very carefully the practice partner. And the final part, you have to actually give some mocks. I mean, you can give some mocks even those who have passed the exam, or there are good mentors like Dr. Imran sir, Dr. Ayesha, and also there are other mentors. But the thing is that a lot of doctors, they think like we have to go to the academies, okay? And it's just like a kind of a myth. So you have to go to the academy. It's nothing like that. So you need a proper guidance. But the mocks, it has to be for the fine tuning and the, I mean, self-improvement analysis at the very beginning of your preparation. You have to make the knowledge and your structures right. So now come to the knowledge part, right? I'm not going to say the scripts are bad, okay? There are lots of script, but from the script, what you can do, you can gather the knowledge in your head, okay? And the NHS website, suppose you want to go for the the earwax. So type earwax NHS, done. I mean, you want to go for, suppose, what should I say? Like moms. So just type moms NHS. So type the thing that you want to know and type NHS, is going to come everything, okay? You can go from there. Now, okay, good. So coming to the structure. A structure is the main thing of this whole exam. So if it is medicine, it is, I always say, like 5 plus 3. So take history for 5 minutes and 3 minutes for the management. In case of counseling and in case of ethical stations, it is 4 plus 4. I mean, take history for 4 minutes. A lot of doctors, they do not understand like what history we should be taking in the ethics, or in case of ethics. Well, if you don't take history in the ethics, I mean, you're not going to get marks in the data gathering. So you have to take some sort of, I mean, 4 minutes for the history and 4 minutes for the management. In the surgery, I mean, psychosocial part is very important. I have written this because a lot of doctors, they miss this part, because after the surgery, they need someone, because just after the surgery, you need some support, because you have to go to the house, like 48 hours, some, observations by someone. Ethics is something very interesting cases. Option gynae like the 4Ps, and pediatrics don't miss the BART and the head to toe things. Psychiatry famish, you have to understand like how to do the famish. A lot of doctor, they will do the famish, but try to be a little bit different from others. Okay. And one request, just don't follow the scripts blindly, because I learned this from Dr. Imran sir, Dr. Ayesha, like try to be a little bit different from the script. Okay. The thing is that I got like 12 in 4 stations, alhamdulillah, and rest 9, 10. All the stations that I got 12 in the 4 stations, I said a little bit different from the scripts. Like in the Simmen, I got also 12. In the other 2 ethical stations got 12, and 1 medicine station. All the stations, one common thing, I try to understand, I mean, why did I get good marks? Because I said something which is not in the script, but which is very relevant to the station. So I always tell doctor, please, scripts are not bad, but try to come out of the script. You are a doctor. I mean, you are already a doctor. So, I mean, you can say something, okay? So examination part. So examination, I always say like 3 + 3 + 2. I mean, 3 minute history, 3 minute examination, and 2 minutes for the management. Okay, you have to be very careful about the time management. And finally comes the Simmen. Okay, so Simmen, it is the ABCD. Okay, I mean, you have to know the basic structure of the ABCD. Simmen is not difficult, but it needs practice. Okay, you have to practice Simmen properly, and you can practice over the pillow. Good. Practice partner is very important, guys. It is right. I had 17 study partners. Okay, 17. Yeah, that's true. You have heard it right. So I had like 3, 4 fixed practice partner with my practice, and random. I mean, I did not practice with them all the time. I had also random study partners. Like I did not want to be comfortable with them only. That's why I had some random practice partner. Much things to do. Okay, good. The structure, knowledge, and the practice. At first, you will have the structure in your head, like how to proceed. Then you'll have the knowledge from the script and the NHS website, and then practice. And let me tell you something very interesting. Like in my first attempt, okay, I did not practice. I thought like, okay, it's just a knowledge base. I mean, let's go and just do it, because I'm an extrovert, I can talk properly. I did not practice. I failed for that reason. But later on, I realized I have to know my mistakes through practice. So don't think like, okay, let me complete my script, let me complete my structure, then I will practice. That is the wrong conception. Start practicing from the very first, from the very beginning. Learn your mistakes through the practice. This should be the, the thing. Okay, and how to get like good marks? So treat the patient who is sitting. That's another thing. Like, suppose I got the migraine patient. I'm just giving an example. So don't treat migraine. Okay, don't treat migraine. Treat the person who is just sitting in front of you. I mean, treat the problem like, doctor, I'm having this. So treat the symptoms. Like, okay, let me tell you something. Like in case of premature ovarian failure, okay, the person is complaining, doctor, I don't have any hot flush, nothing, but I have some dryness in my vagina. Okay, I'm dryness in my private part. So when you are coming to the management part, when I'm doing these sessions with doctors, everybody is telling, okay, we'll be doing these fertility things, IVF, this thing. Nobody tell me, okay, we'll be giving a lubricant for your dryness. Management means just giving simple lubricants to this patient. I mean, this is the thing. I mean, don't treat the condition, just treat the symptoms. So first 4 minutes or 5 minutes, the history, and the second half is the management. What you are listening in the history part, bring that in the management part. That's what they want, actually. They don't want you to be scripted, like what you have memorized, you're not going to vomit that. What you're listening in the history part, just bring that in that management part. So you have to be very careful, and you have to be very careful when you're listening, okay? Very important thing. Good. Guys, you're getting my point, right? Are you with me? Guys, if you don't...
Yes, doctor. Yes,
Yeah.
yes.
Very good. Thank you. And I'm done almost, okay? Just 2 to 3 minutes more. Okay. So domain, right? So you have to understand how they mark you. You have to understand that. So one is domain and the one is the skill area. So these are the 3 domain they mark you, like the data gathering, management, and the IPS part, right? So let me tell you the honest opinion. I always tell everybody, if you want to learn the IPS part, you can learn from Dr. Ayesha. I mean, she's super natural, and I developed my IPS through practicing with her, and also Imran sir. I mean, he's super good. Okay, Imran sir. I mean, he was very rude with me. I mean, he said, Zibran, do this, do this, do this, and but at the end, I called him after getting my results, sir. I mean, alhamdulillah, I have done it. And so IPS, I mean, you have to have some good mentors. Okay, and Dr. Shai also is very good. I mean, I learned a lot of things also from her sessions. Yeah. So like the data gathering, what you have to gather in the data. Okay, a lot of doctor, they don't understand, doctor, in the euthanasia station, how we can gather data. Always there is some scope of data gathering. Like the first 4 minutes is for the data gathering. Suppose, I mean, you have done some mistake, like medical error. Okay, like you could not find the what should I say, like the it is a you just change the x-ray with someone else x-ray, and it is there is no pneumonia in that patient. So just after you enter, when he's calling, you're saying, okay, so I'm sorry, I mean, you have done this I mean, just after 1 or 2 minutes, if you disclose this is not a good station, first 4 minutes, gather some data, just go slowly. Okay. Just when you are breaking the news, just break it in layer by layer. Okay, I don't know how to tell you this, but I don't have a good news to tell you. Okay, I mean, there's some mistake from outside. I mean, don't mention like from all the script, everybody's saying, so being as a doctor, being honest with you, I mean, don't go with the flow. Okay, just be a little bit different. Okay, so the data gathering part, remember this, there is always some scope of data, like first 4 minutes, then the management is the next 4 minutes. This is for the ethical and the counseling stations. If it is medicine, like 5 plus 3. Okay, good. Don't forget to gather the data and management in case of combined stations, like testicular, abdominal stations. Okay, in those kind of the combined stations. And IPS is nothing. IPS means just listening to the patient very carefully and acknowledging the patient's, I mean, concern. I mean, all right. And when the person is talking, you're not going to interrupt him or her. And let me tell you guys another secret. So all of us think, now the bell is ringing, like the 6-minute bell is ringing, and now I'm in the management, so I have to finish my management, right? So I always make this joke. Okay, like we think, so please shut your mouth. So this 2 minutes, it is my 2 minutes, and I have to finish the management. Please shut your mouth, and you just keep guys talking. This is the most I mean, wrong thing, I mean, we are doing actually. Like in the data gathering, you're involving the patient, right? In the history, you are asking question and patient is giving some reply. It is two-way communication in the data, I mean, in the history part. When it comes to management, you completely forget about the patient. You say, okay, just hold there, okay, it's my turn, and you keep talking. This goes because it's only 2 minutes remaining. No, wrong conception. After 2 lines, say 2 lines, like, so we have few options that, something that we can do from outside and something that you can do. I mean, which one you want to hear first? Yeah, doctor, you can tell anything. Okay, so few things that you can do from your side, and this blah blah things, and okay, few things that we can do. Okay, I'll be discussing with my senior, the 7 issues, right? I'll be discussing with my senior, and we'll be doing some investigations to exclude the other conditions. Okay, and some specific, some symptomatic treatment. Then most importantly, the safety netting. If you miss safety netting, you will fail in the management part. So I always tell, if you remember 2 points, you are going to ace this exam: eyes and safety netting. I always tell in all my sessions, like eyes and safety netting. Don't forget these 2 things. You can forget your own name, but do not forget the eyes and safety netting. Okay, good. So guys, what are the skill area? I'm taking time. Okay, just almost there. So consultation. Okay, consultation means, okay, how they mark in these 10 sessions. I'll be going very quickly. Consultation means, if when you are talking, you are disorganized, like you are taking history, you are doing the management, again you are taking history. I mean, suppose I'm taking history, suddenly the patient asks me one question. Are you going to give the answer then and there, or are you going to say, this is a very good question, I'll be coming in a while? Done. That's it. But if you say, okay, yeah, I'm giving you the answer. So you mentioned you are having this. The answer is this. No, 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 wrong. Complete your history. So this is a very, very good question. Okay, I'll be coming in a while just to have a better understanding. Can I ask few more questions, please? Good. Then you continue your history and you give the answer in your management part. This is called consultation. The history separate, management separate. Okay, make it an organized one. Consultation means organize. Diagnosis, you have to give the diagnosis. Okay, yeah, for the diagnosis and the explanation, there is 1 mark. Okay. Examination, a lot of doctor, they ask like, doctor, if it is a telephonic consultation, should you mention the examination? You can mention in a, in a, what should I say, like intelligent way. So when you are coming here, we can check your observations and we can do some examinations. Just mention the examination to get a tick mark. Findings, it is kind of examination, and they are giving some clue in the history or in the station. Are you going to catch those issues? Okay, issues is the main thing. So father wants to talk about daughter depression or any kind of stations like confidentiality. Are you understanding whether this is a confidentiality station or this is a kind of different stations? Are you going to catch the main issue of the stations? Okay. Language, yeah, a lot of doctor were from like subcontinent area. So at the patient is going to understand your language. And a lot of doctor, they're afraid like, okay, I don't want to get tick mark in my language, so I am not going to tell the patient, can you please repeat? Wrong conception. If you're not understanding anything, you can ask very politely, would you mind to repeat once more, please? You can ask that actually. If you're, it's better to ask than, giving any wrong information or wrong false informations. Okay. So if you're not sure, you can ask very politely. Okay. Listening. No, a lot of doctor, they have this problem, like they do not listen to the patient. They are more into their knowledge. Please be there. I have to complete my station. Okay. They do not let the patient finish their line. Kind of hyper, So they say like, okay, they are very, hyper. They try to finish their session. Wrong. They like calm doctors. They like calm doctors. Okay. Now coming to the management part. Yeah, management, I mentioned like 7 steps, right? So I'm going to keep you under observations or admission, something like that. Then the senior will come, then the, investigations. You don't need, you guys will be surprised. I've talked with a lot of doctors. They did not even mention about the paracetamol even. You don't have to know the name of the medications even. So you can say, okay, I'll be giving the appropriate medication after talking with my senior and after checking the book and according to hospital protocol. You see, like I have said 3 lines. After taking my book, what called, intelligent management. If you know the station, that's very good. But if you do not know, there's nothing to be worried about. Okay. And building the rapport. At the very beginning, when you're saying, hello, you do not know whether the person is dying or whether the person is, at the very beginning, you have to show your energy. Like you have to go with the very smiling face. Hello, I'm Dr. Zibran. I'm one of the junior doctors working in this department. And can you please confirm your name and age for me? And they're going to say, yeah, doctor, I'm this. Oh, I see. Then you can see like she's sad. But before that, don't just break your voice. Hello, Dr. Don't be very low. So at the very beginning, you have to be, with a high tone, with a good smiling face. And then you have to change your voice suddenly. Oh, I see. Like, is everything all right? So this transition in your voice, this plays a very vital role. And this kind of, why I tell people, why every body tell, like, do it over the video. The reason is that you have to see the whole of the body, like the hand movements, like the attitude, like the body language carries a very vital marks in the overall approaches. So we are almost done. Like the time management. Yeah, time management is nothing like this time, the number 10 point, you can actually correct this with practice. If you do lots of practice, actually you can come out of this situation. That's it. And thank you very much. And I'm really grateful to Dr. Ayesha. I mean, she's my very close friend. I really admire her efforts, and it's still her number is saved in my mobile. Like Dr. Ayesha, helpful doctor. I mean, she has a tendency to help the people. I really like the way she's helping everybody. I really like the way Imran sir teaches us. We're really grateful to sir because I mean, in his busy schedule, I mean, she has made some time for us. We're really grateful, and we know everybody, Dr. Saher. I mean, how she's helping with her notes and all the sessions, and just keep helping each other, okay? And this is the way this is the way that we should be proceeding, and don't feel yourself like you're not alone, okay? Everybody else are in the journey, and let's help each other. Thank you very much for this session. Thank you. Bye bye.
Thank you,
Well,
Zibran. Assalamu alaikum.
you're welcome. You were very comprehensive, and after three major, huge celebrities talking, I don't think there is much for me to say because you all have added too much of everything. I think it's just the norm of the exam. As quick as a person understands, that's better. When the later you understand, the more painful the preparation for the exam is. Now, I'm not going to take much time. I'm going to be very brief with a few advices that I personally think they worked a lot for me. And I think that even if someone is a beginner, they should keep it in mind. And if someone is, they're taking the exam in 3-4 days, in 10 days, 15 days, it's an advice everyone can use. The advice is that please be natural. Be yourself in the exam, right? You have your MBBS degree. The NHS does not want to burn your degree. It does not want to burn the knowledge that you have. They have assessed your knowledge in Plab 1 anyway. So when you go with the scripts, what you do is that you're not natural anymore. You're someone who the academy has prepared. You're someone who the scripts has prepared, and you're focusing more on making sure you're asking all the questions in the structure, and you're focusing on the 7 steps of management instead of really listening to the person sitting in front of you. And it's a very famous quotation of a doctor that listen to your patient. He's telling you what's wrong with him. Don't diagnose him. Listen to him. He himself is telling you what is wrong with him, and he himself is also giving you the solution. And that's something that is happening in the exam. They're giving you a problem, but at the same time, they're giving you a solution as well. And I'll be going along with whatever I'm saying with examples, like someone who's coming to you with varicose veins that are not complicated. The lady is going to tell you that if you're going according to your structure and you're asking questions, so in the psychosocial section, she's going to tell you that my job is a hairdresser's job. And when you're natural and you understand that someone is a hairdresser, that means they're standing the entire day. You talk to her about that and she tells you, yes, but that's a part of my job. I can't stop it. So what you have to advise her is, like a natural doctor, like a normal day, you're sitting in your OPD, you're going to tell someone that if standing is causing a problem, how about you take breaks or you do your job by sitting? A very possible thing in certain jobs. So which is why it is important to be natural, and acknowledging concerns is something that should be your priority since day one. Now, why is concerns so important to me, and why do I emphasize on that a lot, is because see, the exam cases are the same, but someone does one thing one day, he passes, the next day you do the same thing, you fail. Why are you failing? Why is the other person passing? The problem is because you thought you would be asked the same questions that he was asked, and you go to the exam and you answer what he has learned, what he has taught you. So you answer from what you've learned the day or 2 days before, and when you're answering, you're not really addressing the concerns or answering the questions the patient is asking. You are actually telling him what you've learned, and that they don't even bother to ask you other questions. They don't bother to even talk to you. They directly fail you. If the simulator is sitting with the examiner, they don't think about it. The example of that is you're breaking bad news, and the simulator's first question to you is, doctor, how long does my father have? And instead of answering that like a natural doctor that would say that I'm really sorry, it's very difficult for me to say how long your father has, you go along the lines and say that when your father was brought, so we decided we will not do the surgery and we will go ahead and do a palliative care. Have you heard of palliative care? So she's not going to interrupt you at all. Remember, he, whoever is your simulator will not interrupt you. The best way you can avoid this A very common mistake that people do, they end up failing, and a very, very easy thing to avoid and be natural is address the concerns. Ask your patient questions. Whatever is their question, try to answer honestly. And the answer to that is on the NHS websites, in the scripts, but don't talk from yourself. Listen to the patient, gather the data, and then bring it to the management section and deliver it. Because if you're not addressing concerns in the management section, and you're thinking that I've set the 7 steps, I've even given her a leaflet, you're going to fail. Trust me. So ICE, idea, and then specifically concerns. Concerns is something that they're constantly changing in the exam, which is why there are challenges for people to pass the exam. And the reason is it's the same history, it's the same stuff. The questions have changed. Someone might have had a problem 2 days ago with their job in the exam, and when you go on your exam day, she's saying that I have a problem in walking up the stairs in my own home. So you can't talk about her job if she has a problem at her home. Am I making sense? Because what I'm trying to tell you guys here is that you need to actively listen to your patient and address what they're asking you, because they're asking you so that they can pass you. They're asking you those questions to make sure you get across that border and you don't stay where you're under a question mark whether you're going to fail or pass. The other important thing that everyone said, stick to your structure, and sticking to the structure is very important. Specifically, a lot of doctors, what they do is they do the DDs, they do the questions, but they skip the section of psychosocial and smoking, alcohol, diet, exercise a lot of times. The reason they do it is because they say we don't have time. Now, an example of that is that the whiplash injury lady who's coming recently in the exam, she asks you that I need financial support. I am the sole bread earner of the house, and my mother is helping me right now, and I just need a sick leave so I can support my son who has Down syndrome. I need a sick leave so that I can search for a job and I can support my son who has Down syndrome. Now, why is she telling you that her son has Down syndrome? She is telling you that, and if you don't go into the psychosocial section, you will never find that out. She's telling you that because in the management section, you can bring it up. You can tell her that I can't give you a sick note because you're perfectly fine, but your son, you mentioned he has Down syndrome and the government can support you. Now, that is something a lot of people don't pick because they don't dig into the history. So you have to do your questions. You have to stick to your structure. Don't forget psychosocial and smoking, alcohol, diet, exercise, because a lot of times you only need to fix these things. A bit of a lifestyle, a bit of a psychosocial adjustment, and that is all you need. I practice that in my exam in many cases. I only advise them to cut on smoking, quit alcohol, all of that stuff. And just a few lifestyle modifications. Like you have a problem standing, how about you do this thing by sitting? You are gaining weight, but you're a teacher, you don't have time. How about you walk during your classes? So it's you're working out and you start losing weight as well. So that is upon you. If you're natural, if you're sticking to what you know as a doctor, if you're sticking to taking that day as an ordinary day and coming up with your own mind and your own logical explanation of how to fix a problem, I don't think that passing the exam is a problem at all. And if you go with this strategy of addressing concerns properly, digging in and validating the concerns and acknowledging the concerns, Yani, acknowledging the concerns as in someone is like talking to you and all of a sudden in the past medical history, they're telling you, yeah, I have high blood pressure. It's such a problem, all the time, taking 3-4 pills. They're telling you something so that you can comment on it. And instead of saying, okay, so do you have any allergies? Are you taking any medication? Instead of going that way, what you can do here is you can say that, oh, I'm so sorry, Adam, you're going through so much. I know tablets can be a nuisance, but being hypertensive, you really need to be careful because blood pressure isn't really a good thing. So don't be scared of talking to the patient, right? Be natural, be yourself. It's fine if you talk to the patient. It's absolutely fine if you comment on anything at all that's out there. If their glasses are broken, you can comment on that. If there's a water bottle lying next to them and they're complaining of tiredness, you can comment on that. If they have facial pain, they're wearing a mask, you can comment on that. You can tell them, you must feel a lot of pain, you're wearing a mask. There's no harm, there's no way they'll fail you if you're natural. There is a problem when you're scripted. So that would be my advice to everyone, either the beginners or the ones taking the exam in a few days. Just be natural, be yourself. If you're not natural, if you're sticking to the scripts and you're learning someone else's question answers, it would be difficult. It's a difficult journey that way, but it's very easy if you believe your own intuitions, if you believe someone really looks troubled in front of you, someone is really going through something, because a simulator sitting in front of you is giving you clues. They're giving you clues because they want you to address them. They want you to pick on them. And in the new building, what I've heard of people who have taken the exam is that there are three people in the station. One is a simulator, one is an observer, and one is the examiner. So remember your body language, your way of conduct, whatever you're doing, they're watching you. Three people are watching you, three people are assessing you. So be natural. If they're giving you a clue, if the simulator is constantly moving his leg, they're constantly, shaking, they're giving you something, just take it and talk about it. You'll regret if you ignore it, but you'll never regret something that's there and you talk about it. So that would be it. That would be my advice. There wouldn't be much that I would add. I just want everyone to be natural in the exam. I hope that the session was helpful. Thank you so much, Dr. Imran, Dr. Saher, Dr. Zibran. All of you have been such a great help. And I'll be uploading this session on YouTube, and I'll be posting a link as well. We're not taking questions today because this was more of an advice session, one talking instead of dual-way talking. And best of luck to everyone who's going to take their exam. I hope this is the last time you're taking this exam and you pass with flying colors, inshallah. Okay, ji. Assalamu alaikum.
Thank you, doctors. Thank you, everyone.
Thank you, everyone.
Thank you so much.
Thank you.
Thank
Walaikum
you.
Assalam.